have a look at this simulation today. So I've got a dentist who sent me a 14-year-old girl, and this is her chief complaint is just a bit of an overjet and possibly some crowding, the lower crowding. So what we have is a typical class 1 teen female who's got class 1 skeletal and dental malocclusion with some increased overjet, mild crowding in the upper arch, mild crowding lower arch, and some moderate deep bite. Now, the key is whenever we look at deep bite, we've got to consider where is our upper incisor. So in this case, I can't show you the photo, but in this case, the upper incisors are displaying at about 60% upon smiling. So we definitely don't want to intrude those upper incisors to reduce that anterior overbite. And we've got some significant incisal wear here as well, and also on the lower. So you can see it's difficult to position these for ideal occlusion. All right, so let's have a look at what this dentist did. Now, this is a very simple case, all right? So the dentist has decided to do IPR to reduce overjet, and the dentist has also not given much instruction to the technician on how to align and level. Now, I'm going to give a little compliment to Spark technicians here. And a lot of experienced orthodontists will understand what I'm saying because Spark technicians are very good. So even if the dentist didn't really consider many of the factors and didn't give the right instructions, the technicians actually didn't do a bad job. And what I mean is that final positioning of the roots and everything, like for example, they've tucked the roots in lingually, they've done some extrusion here, some intrusion. They also did light intrusion, much lighter intrusion in the upper arch. I just think overall they set up pretty well. However, let me show you plan 2 of what I've done, okay? Because I wasn't happy with it because A, the velocity was very short. So in the previous dentist design, the velocity was only 16 aligners. Now we know no way we can fix this in 16 aligners. So that's the biggest mistake that a lot of aligner companies make. They don't give us enough aligners. And I just kind of really scratch my head, and I still don't understand why they do that, because they know very clearly that we have needs for refinement and which movements happen and which don't. Anyhow, moving on from this, what I'm seeing here is what I've done, right? So the changes I've made. So let's look at what I've made. So what I did was I added a bit more expansion. So you look at T1, T2, and just from expansion, you don't need IPR. You're able to reduce that overjet, right? Because when you expand back to the molars, you can get some light retraction of those upper incisors, and you're also broadening the arch form at the premolar region. Okay, so this is an adequate amount of expansion for a growing child. Then let's look at what we've done with the deep bite correction. Now, the dentist had planned for a lot more anterior intrusion, but literally no posterior extrusion. So what we have done is built this reverse curve of SPE. So what we're doing is correcting this curve of SPE with posterior extrusion and anterior intrusion, and that's a very, very predictable way in children or growing children to correct deep bites. What we've also done is ensured that we don't intrude our upper incisors too much. So you see there's hardly any intrusion, and that is really what we've done because she was only displaying 60-70% of our incisors on smiling. And then appropriate attachments. For example, we have considerable movement on this tooth. And one would argue even the 3-2-4-2, the lateral, lower lateral should get attachments. But let's just start with set 1. And, you could always add some attachments here. You definitely need attachments to extrude these posteriors. And the best one is the horizontal conventional. You've got a bit of rotation on those canines. So we put vertical or tipping on those canines. And then if we look at the anterior, we're actually derotating our upper lateral incisors. You definitely need attachments on that. Let's look at here. We are again moving and creating buccal root torque with expansion on our upper posterior. So we need attachments for that. And the upper 7 here, you see it's being extruded and also adding buccal root torque. So obviously there was lack of attachments in the first set, there was unnecessary IPR, and there was not enough aligners prescribed. So what we did is change the velocity. So you see you can change the velocity here, and asked for 35 upper lower active aligners. Now that's about 7-8 months of treatment if they're wearing every 7 days, and that does help improve predictability. So slowing down movements has shown as an indirect effect to improve predictability. And I do think that this is my biggest tip, that you should consider velocity. There are orthodontists out there who do say not to change this, but I disagree. Every time I have doubled my number of aligners, I have literally finished the case in set 1 or set 2 and done it very predictably. So I've got considerable experience in changing velocity and getting very good results. So I would recommend for that. And yeah, so these are my tips. I hope you enjoyed learning from this case. So it's really a mild class, I'd say moderate deep bite case with some moderate overjet and a class 1 teen. And how we reduce that overjet and get an ideal overbite, right? Let's remove. And at the end, we're going to have this ideal overjet overbite. Now, the dentist has been told that they should look at this incisal wear and possibly reshaping or bondings at the end, because even in the upper arch, you've got some uneven wear. All right, guys, thank you for watching. Bye-bye.